Health Benefits Associates, your Nevada Medicare experts. Call them today.
Healthcare is a journey, and as people go through this journey, they start with their primary care providers and they follow up, they keep their, hopefully, medical illnesses at bay. If they develop medical illnesses, they're diagnosed and they're treated. Sometimes the patient will need to be seen by specialists. I'm a cardiologist, and if you need something that's concerning for the heart, many times your primary care provider may refer us to a cardiologist or any other specialist. I'm very proud to have launched the Reno Heart Institute. At this point, nobody tells me how many patients I have to see every day. Nobody tells me what time I have to see patients. I get to make that decision, and I get to do what I think is best for my patients, like I would want my family to be taken care of. And secondly, being an independent cardiologist gives me the opportunity to work within all of the health systems in our area. And so I can work with all of the hospitals, I can work with all the different providers, and I think that's important for continuity of care with our patients. And so I don't want patients to come in and say, well, I can't see you anymore because I have to go to a different insurance plan, or I have to go to a different hospital that you're not part of. I want patients to be able to see me regardless of the changes in their life, and we want to be at least something that's stable in their healthcare. So just like healthcare is complex and ever-changing, so are healthcare benefits. Patients ask me all the time, well, what insurance should I go for? What health benefits do I need? And my father a few years ago went on Medicare, and he realized there's hundreds, if not thousands, of options, and it can be quite overwhelming. Just like I told my dad, I said, you need to find somebody that can help you navigate through this complexity, because what's right for my father may not be right for anybody else. I strongly encourage my patients to find somebody that can help them find the plan that fits them, just like you find a doctor that helps with the treatment that fits you. So I'm fortunate to have gotten to know Health Benefit Associates, and I got to learn a lot about healthcare and the benefits associated with some of these plans. So, reach out to somebody like that. Reach out to somebody that can help you navigate this complex, but I think very fruitful relationship that you can form to find a plan that fits you and your needs. Unfortunately, heart disease is the #1 killer in America. Heart disease continues, even though we've made great strides in treatment, great strides in technology and medications, we still continue to deal with heart disease and the lives that it takes. It's affected my family. My father had a heart attack. He's doing great, but it definitely changed the way he thought about life, his diet, his exercise. Post-heart attack care is very important to long-term outcomes and also long-term recovery, because if you had a heart attack, your heart took a hit, for lack of a better term. And so it's very important to get on A, the correct medications, B, correct follow-up, and C, cardiac rehab. And I think cardiac rehab gets forgotten. And it's a very controlled environment where you get monitored, you get into an exercise program. It gives you a lot of benefits, one being more chance of full recovery and longevity. In fact, up to 50-60% benefit long-term for outcomes.